Hi, I'm Lucy Macdonald, physiotherapist, and today I'm going to talk to you about knee pain in runners. After 20 years of treating marathon runners, I have treated hundreds, probably thousands of runners with knee pain, and there's some really common themes that I think would be really helpful for you out there suffering from knee pain, or indeed trying to prevent yourself from having knee pain. There are a lot of different causes of knee pain, and you shouldn't always just jump to the most common causes, and it's worth me mentioning that there are a few rare but serious causes of knee pain. So the most obvious one being stress fractures. Now, if anyone has ever watched my videos on stress fractures, or any of my videos on good pain versus bad pain, then you'll know that knees aren't the most common area that runners get stress fractures in. So it is unusual, but possible. So you do need to get your knee checked out by someone who is accustomed to seeing large volumes of runners, whether it's a physio or a sports doctor, to make sure that you can rule out those sorts of things. Other really unusual causes are referred pain from either the hip joint or the back, but definitely worth ruling those out too. So once we've covered those things, then what we're looking at is whether it's actually the knee joint itself, so the joint between the femur of the thigh and the tibia of the shin bone, so that sort of main knee joint itself. Is it something going on in there? So is it the meniscus, your cartilage, one of the ligaments either side of the knee, more commonly the inside of the knee? And those again are less common, although sort of generalised wear and tear of the knee joint itself is relatively common. So first thing to do with that is to make sure that you're sorting out your biomechanics and the strength of the knee. And I'm going to cover that more later on in this video, so that so that you've got some exercises that you can be getting on with if that's the case. But on that note, we do know that running, one of the most common things, sort of myths there are out there about running and knees, is that people say, oh, running's bad for knees, and we now know that actually it's not. So on balance, we think that so the research shows that running is not bad for knees. In fact, we think it may well be good for knees, as long as you're doing it correctly, as long as you're putting all the things in place that enable the body's structures to recover, like good nutrition, rest, sleep, and doing some cross training as well, doing strength conditioning, checking your alignments right, all that sort of thing. So all of that in consideration, running is good for the knees, because that impact actually stimulates the structures inside the knees, and can actually help to keep things like cartilage, meniscus nice and healthy. So that's good news. So those are the less common causes of knee pain in runners. The most common are knee pain around the front of the knee. So at the moment I'm getting lots of people with pain around the front of the knee, so either patellofemoral joint, so in other words the kneecap is involved, or the patellar tendon itself, which is the tendon just below the kneecap, or the ITB. And for those of you that have not got to know your ITB yet, it's the structure that runs down the side of the thigh and inserts just below the knee joint itself, and often the pain manifests actually around the knee. So I'm getting loads of people contacting me with those kind of queries at the moment. So I thought I'll focus the rest of this on those injuries. But as I said, the treatment for the wear and tear, the kind of main joint issues, will be covered by the treatment of these as well. So patellofemoral joint pain, so kneecap pain, can kind of move around. You might just feel it in one part of the front of the knee, or you might find that it's on the inside one day, on the outside, sort of shifting around underneath the kneecap in different locations, and that's normal, very, very common. And then patellar tendon pain is more, you can sort of poke it, you can isolate it. So if you sort of poke around the front of your knee, you can find the bit that's actually tender, and kind of when you poke it, it's ouchy. The other thing, the reason I paused just then was because Another indicator, depending on where that ouchiness is, that can be, if it's the bone that's ouchy, then that can be one of the indicators of a stress reaction in the bone. So again, going back to what I said earlier, you do need to get those things checked out and make sure that you rule those things out. And then the ITB, as I said, you should be able to locate the pain to the outside of the knee where the ITB attaches just below the knee joint. So what do you do about knee pain? So actually, irrespective of which structure is causing the problem, there are a few common things that you can do to treat it, and they are unfortunately not necessarily sort of standard treatment with other physios, osteopaths, chiropractors, unless they are accustomed to treating high volumes of runners. So the most important thing to bear in mind is that the knee sits between your hip joint and your foot, and often problems at the hip joint and the foot are the thing that causes knee problems. So the first thing that you need to get checked out, and the first thing that you need to take a look at, is your pelvic posture, because it's your pelvis that dictates the position of the muscles around your hip. And actually, for example, your ITB starts at the top of your hip, so it inserts into a muscle called your tensor fasciae lata, which sits actually over the front, slightly to the side of the hip joint. So your pelvis has a huge effect on the function of your knee, and you can make sure that your pelvis is in neutral by doing some of the exercises on the website, like if you do the foam roller. I'll put these underneath the video, but the foam roller series is a really good series of exercises which teach you how to hold your pelvic neutral. Things like Superman exercises, but ultimately, most importantly, putting it into the running man exercise. So putting it into an exercise that mimics running itself. And that is absolutely essential. I see far too many people doing lots of lying down exercises and then not translating it into a standing up exercise that replicates running. So the running man exercise is brilliant for that. You're going to get a bit of a running theme with this. Oh, no pun intended. The next part of treating knee pain, once you've got your pelvic position sorted out, is to sort of zoom down the other end and look down at your feet, and to look at whether you have any instability at the ankle and the foot, and to improve that doing exercises like tiptoe stand with corrected ankle alignment, which again I'll put underneath this. I think it's video 42 on the website. And also looking at whether your pronation is normal. Pronation is a normal part of the walking cycle. It gets a bit of a bad name, but it is a normal part of walking and running. So worth looking into that, and I'll put down a couple of exercises for that as well. So then if we kind of zoom back up to the hip stability, and in other words, the muscles that are supposed to stabilise your hip around the outside of the buttocks, so your gluteus medius muscles, as opposed to the muscles at the back, which are more your powerful muscles. So your gluteus maximus around the back of your bottom powers you forwards, but actually the stability muscles are more the muscles around the side of the hip. So as I say, your gluteus medius or minimus, and some of the fibres of the glute max around that area as well. So how do you do those? So loads of people do things like clams or lying on the side, lifting their legs. But again, although they have some value in activating the muscles, it's much, much more valuable to train those muscles in standing. So doing an exercise called the wall ball series, for example, and making your way through that. So where you're activating those stability muscles of your hips, correcting your knee alignment, and training that together in a standing position, which has much more carryover, therefore, into your running. And not surprisingly, looping that all into doing your running man exercise, where you are correcting both your foot, your knee, your hip, your pelvis, the whole shebang, sorting out that alignment so that the forces are going through your knees, being spread out through the knees in the way that they should be, to minimise the amount of pain that you are getting. And in some cases it can be immediate. You can get immediate pain relief So I've seen lots of people who've had loads and loads of sessions of physio or other kind of therapy, and they've been doing loads of clams and all that sort of thing, and then they come and see me. I give them a couple of standing exercises, and bish bash bosh, their pain goes, and they're able to continue their training pain-free and complete their marathon with no problems. And I think that's super, super important. If you're struggling in your rehab at all, then you really do need to get a second opinion. And please do drop me an email, and I can try and advise accordingly. The vast majority of knee problems are completely treatable with physio and really, really shouldn't stop you from running your marathon. So we've covered pelvic posture, we've covered ankle stability, hip stability, and the other most important thing to bear in mind with knee pain is to sort out the general strength of your quads and your hamstrings and your glutes muscles, and doing things like a split squat, or lunges, and general squats is really important. And then likewise sort of higher level stuff like core work, like planking, is also very important. So I will write down all of these things underneath this video so that you can kind of be getting on with some of those exercises. But before I bid you farewell, just to remind you that you do need to get your knee pain diagnosed, sorted out. You do need to rule out things like stress fractures or referred pain from elsewhere, and then before you're then progressing with the exercises. In the meantime, do not run through the pain, and make sure that you're putting everything in place to recover properly. So your nutrition, your sleep, your cross training, and your rest. Don't underestimate those things. So please do get in touch if you have any queries. My email address is lucy@octopusclinic.com. Follow us at Octopus Clinic on Facebook, Twitter, and Instagram. And in the meantime, enjoy your training and happy running.